What is a dry eye? Well, first of all, you need to know that the eye is like a camera with lenses at the front and a photographic film at the back called the retina. There are two lenses to focus light at the front of the eye: the cornea, where you place your contact lens, and the lens inside the eye, which is what goes cloudy when you develop a cataract. The most important and strongest lens is the cornea, or clear window at the front of the eye. For the cornea to focus light accurately, it needs a nice clear and shiny front surface, and this is the main role of the tears. If you have a dry eye that does not produce a healthy tear film, the focus is poor and usually produces blurring of vision that improves on blinking. The other role of the tear is to keep the surface of the eye comfortable and protect it from dust and other debris by washing the surface of the eye on regular occasions when you blink. A dry eye can therefore cause sore, gritty eyes as well as blurring of vision. There are two main layers to the tear film. There is a watery layer that is produced by the lacrimal glands on the outer aspect of the upper lids, and an oily layer which is produced by meibomian glands that are all along the lid margin just behind the base of the lashes. The role of the oily layer is to float on the water to stop it from evaporating and hold it in place. A problem with one or both layers will result in dry, gritty eyes. Some people mainly have problems with the watery layer, and this can be seen in a condition that is often associated with rheumatoid disease, and it's called Sicca syndrome. And here the lacrimal gland stops producing the watery tears, and patients often have a dry mouth due to the salivary glands also not producing saliva. Some people mainly have problems with the oily layer, and this is usually in association with a very common condition called blepharitis, or sometimes called meibomianitis, where the meibomian glands are inflamed and produce a thick oil which sticks to the lid margins and does not produce a nice thin layer of oil over the water. As a result of this, the water evaporates quickly and the eye dries out. More water is produced to try and counteract this, but because it's not held in place by the oil, it can run over the cheek and cause tearing. This is the reason why some patients with a poor tear film actually complain of a gritty, watery eye rather than the usual, a gritty, dry eye. Most patients, however, have a combination of poor production of the watery component and also a poor oil layer to the tears. In severe cases, there is loss of cells called the corneal epithelium, which relates to the surface of the cornea, and this exposes the underlying nerves, which can cause considerable discomfort and also results in inflammation on the surface of the eye, as well as the dry eye.